Yes, yes. Yes.
Finally.
Working now.
I know, I know. I hope I'm visible, audible.
Yes, you are. It's a little blurred in between, but that's okay. We can hear you clearly.
I'm okay if you can't see me. I want you to hear me. So if you can hear me, that's well and good for me.
Fine, ma'am. I think we can start in another 2 minutes. Let people
Yes,
join in.
yes. And I'm so sorry for the inconvenience. I have no idea what has happened. It has never happened. And I don't know. I keep on traveling to Dubai a lot, but this is the first time I'm actually facing this issue with the
That's
live.
why you're wondering that the net connection is fine from both
I
ends,
know,
and well,
I know.
that's okay.
Okay. I hope
As
that's
long
fine. Yeah.
as you're having, it's okay.
I know, and I'm so sorry to all the uh, people who are joining. They have been joining. I can see all the names repetitively coming, joining back, coming back. So seriously thankful to all the guys who are so consistent. And they are really what to say. That's really nice of these people. I could see the names. So I welcome you all. Before it's there live, but it's like I am actually more what you can say welcoming
Ma'am,
for them because it was really annoying.
it's equal effort from both ends.
I know, I know. Yeah. Okay. I think we can start. Uh,
So, good evening, everyone. I, Kashika Bhatia, your host for the evening, welcome you all today to our live session, Unfolding the Myths of Cardiopulmonary Physiotherapy. And today we have with us Dr. Samana Sayyed joining us here live from Dubai. So, Dr. Samana is a celebrated cardiopulmonary physiotherapist. She is currently practicing in Dubai and she is also associated with many other countries. She is the director of 360 Healthcare, HOD of the Clinic International. She is the only chest physiotherapist who has been interviewed 6 times internationally and she has made headlines in renowned newspapers. She's also the first female Indian chest physiotherapist who was invited for an international workshop by the President House Hospital in 2017 in Africa, and then followed by many other countries. She's the first global Indian COVID rehab educator, and she has bagged multiple awards for her exceptional work during the pandemic and over 50 healthcare awards. She has conducted workshops in over 16 countries and over 200 offline and online workshops. So we welcome you, ma'am. It's an honor to have you here with us.
Thank you so much. That was really wonderful, Kashika, and thank you for the introduction. Sometimes when you get introduced, you realize, okay, fine, chalo, kuch to kaam kiya hai. Something you have worked.
You've done
So
exactly.
I'm just grateful to everyone who has been a part of my journey. And before going ahead, once again, a very happy new year to all of you, and hope this year brings you more joy, positivity, success, passion, and give a lot of time to your family. That's more important. So, yeah, I welcome you all. Thank you once again. So, I'm all yours. You can ask whatever you want to ask now.
So we'll be keeping it more of an interactive session. So do put in your questions in the comment section, and we'll be taking it up. I think, ma'am, we can start with some of the
Yeah,
questions which we already received. So the
sure.
first question is that is it wise to choose MPT in cardio and then MPT in ortho?
Okay, so this is the commonest question. Whenever I go live on my Insta when I'm in India with good network for sure, and or whenever I put questions, this is the most common question that I get. Why to choose cardio when you have MPT, ortho, sports, and everything which are giving you more patient base, more income, more opportunities, and why should a person think about it? So let me tell you, now we can divide this thing as pre-COVID era and post-COVID era. We all know a lot of things have changed in chest physiotherapy when it comes to post-COVID period. In fact, to be honest, it really took a pandemic, as I keep on saying this every time, it took a pandemic for every person to realize the importance of cardiopulmonary physiotherapy or chest physiotherapy. So when we talk about why cardiopulmonary MPT or why to choose cardio MPT, over ortho, the only reason is that because of the upcoming opportunities that you have now, the opportunities that have been created after the COVID-19 pandemic. It's amazing. There is an immense opportunities for each and every individual, not only in academics and clinicals, in our home patient care, a lot of things. We will be talking about it ahead definitely. Now, what happens when you are in cardio? So, and why you should opt it? Honestly, let me tell you about myself. When I opted for cardio, I was really unsure in the same way whether I should do cardiorespiratory or not. So what happened? It was a funny incident. I did my internship and I always felt, okay, मुझे ortho भी आता है. I know ortho, sports also like little bit we can do from the ortho part. That's a mentality of a person. But whenever I enter the ICU, I'm blank. I have no idea what to do. And I'm like phobic, unable to, like resist, what to do. Even touching the patient, I used to feel, okay, kya karna? And at the end, forget about everything. Before even concluding what I could do, there was a preset thing in my mind. It's okay, I have to just give them chest PT or chest percussion and vibration and leave. So that was one of the reason why I wanted to explore this field, and I did it, and I'm thankful to it. But now when I say that please opt for cardiopulmonary PT, it is because of the international, or you can say the global demand of chest physiotherapy, not only in India, but outside India as well. So now let's come to the Indian perspective, because of course, if you're planning to do MPT, your first aim is what? You want to know how much you can earn from it, how much you can bag from that, how much you can explore that field for not just your professional growth, but for your economical growth. Let's be very honest about it. Professional growth is very important. But of course, if you're paid well, you get more, like you are more, you can say, motivated to do well. So when we talk about cardiopulmonary, it is not just about academics, it is not just about hospitals, it is not just about clinical. There is a whole world ahead with that you can follow. So that is one of the reason why you should opt for MPT cardiopulmonary post-COVID. It is because it is not saturated yet like other fields. And if I'm saying that, I'm sure a lot of people who have done MPT, who are in the field for like the last 10 years, they can relate to it. Still, during this COVID-19 pandemic, we used to get so many vacancies for cardiorespiratory physio with very good pay scale, and we were not having people for that. So people who actually acted smart and did it before were the luckier ones, you can say. So now there are so many opportunities, and this is the only field which is not yet saturated. And when something is not saturated, you're always in demand. I think that answers the question well. That you will be in demand for the next 5 years or max for the next 10 years. After that, again, even this field will get saturated, because the demand and the awareness of cardiopulmonary physio after post-COVID is tremendous and commendable. So yes, please opt for it, and rest, I'm there to guide you. Nothing to worry about it.
Okay, so we've covered the scope, and there's another question: that is it better to be an academician after taking up cardio, or as compared to a clinical practice?
See, I would say both have got their own significance. When you're into academics, definitely it's a like because I'm a person who's into academics and into clinical part as well. But honestly, I'm a hardcore clinician, and academics is secondary to me. So that's why I'm more of a workshop person. I have my courses running, and along with that, I work as a clinical clinician as well. So now you need to first understand whether your interest is more into academics and you want to join a hospital and become a professor and be there, or you have to go into the clinical practice. Now, the biggest myth, since the topic says unfolding the myth, the biggest myth of a physiotherapist who is a cardiopulmonary specialist is that they can only work in the hospital setup when it comes to a clinical practice. Yes or no? I mean, I would appreciate if physios can write it over there, yes or no. That's the biggest myth, because they always feel that if you're a cardiopulmonary or a chest physio, all they have to do is they have to get connected to the ICU setup, or they have to get connected to the hospital setup, and keep on seeing the same kind of patients again and again, and specifically those patients who have got chest complications, or those who have cardiorespiratory ailments, or anything that is related to chest with a disease. So that is the biggest no from me. Well, when you are into a clinical practice, you can have your own setup like any other field of physiotherapy. You can have your own cardiac or pulmonary rehab department. Well, when it comes to cardiac and pulmonary, just for the students who have joined us, when we talk about cardiopulmonary, we need to understand that cardiac and pulmonary are two different fields. It's not the same one. Of course, there are a lot of things that are interconnected with each other. So you can either be a cardiac rehabilitation physiotherapist and there is like go in deep into that and have your own identity as that, or you can be a pulmonary rehabilitation physiotherapist, have your own identity as that, or you can have a common cardiopulmonary rehab setup where you can cover everything. So now imagine you already got 3 job options. Now coming more ahead with that. So you can be into a metabolic disease as well. Let it be hypertension, diabetes. You can be a diabetes trainer, hypertensive trainer, preventive life disease trainer. A lot of things can be covered when it comes to clinical practice. You can, even if you are running your own ortho department, you can add up a small scale pulmonary rehab department in that as well, with very less investment. That is the reason I teach pulmonary rehabilitation workshops. I take a certified pulmonary rehabilitation specialist CPRS workshop. The main aim of my workshop is to allow a physio to be independent, to open their own clinical practice, irrespective of the fact whether they are from whichever field of physiotherapy. So that is what you can get as in the form of independency if you work into the clinical practice. So you are not supposed to just be attached to hospital and what you can say, get rotten and stale over there. You have to really work as a clinician ahead. You should have your own setup, and you can actually work as how these ortho people work. Ortho, sports physio, they are having their own setups and all. Same thing you have to just get attached to some physicians, and you can get the patients with moderate severity to your clinical setups, and you can have your own rehab department. So that is one more thing. Now when it comes to again clinical practice, of course you can be a good tutor, instructor. You can get attached to various companies who are hiring and training instructors. Again, you can go into academics and clinical together. You can work as a guest lecturer in various university setups. Along with that, when it comes to the global sorry. So when we talk about the global scope of yours, now globally at present, cardiorespiratory physiotherapy, especially respiratory physiotherapists, are a lot in demand. Now there is a lot of confusion between physios about respiratory therapist and respiratory physiotherapist. So outside India, whenever they see a post of respiratory therapist, they apply and they never get selected. So you need to understand that respiratory therapy is a different field and respiratory physiotherapist is a different field. Okay, so they have a huge demand over there. Respiratory physios are very, very, very famous outside, and they are really minting money well. So you can go outside, do your cardiopulmonary masters, and then get settled over there. So there are lots and lots of opportunities. Along with that, you can have your own social prevalence as well. Now, with the coming, pre-pandemic, during the pandemic, whatever we have seen, the online consultation of lung patients, the rehabilitation criteria has also taken up a good, you can say, a good mark. So even you can go online. Until now, we are seeing patients online. Now, I'll just tell you one thing. If you are into a clinical practice, what is the benefit of yours over a ortho and a cardio or a sports physio? Any pulmonary patient will stay with you for minimum of 3 months and maximum of 4 years or lifelong, because it's a continuing ailment where they need the treatment and they need the maintenance therapy. When it comes to orthopedic, it's a short treatment. No patient will stay back to you. If you're actually not able to treat a patient 15-20 days, then they start doubting your performance. Yes or no? Yes or no? Tell me that. Yeah, because nowadays we have so many advanced techniques, and when it comes to ortho or sports, you are a pro. You know how to recover and go with the fast track recovery. So that's the benefit when you're into a pulmonary or cardio rehab as compared to other rehab. So I'm just giving you the ways and the reasons to join this and think over it and be a good physio. Don't keep on dragging the treatment of your patient. Of course, that is very important. Ethics are very important. So I think
Everybody
that,
quick
yes.
result. Everybody wants quick results and quick treatments these
Exactly.
days.
But
They're
when it
not
comes to Yes, but when it comes to a respiratory therapist or a cardiac therapist, the patient knows that because we counsel the patient. Our work is just not to be a physiotherapist to them and work on the rehab, muscles karo, saas lambi lo, muscles pe focus karo, just focus on your muscle. That's not our thing. We work on the entire holistic approach of the patient. Let it be their counseling, diet, their muscular growth, their neuromuscular involvement. It's like from head to toe you are seeing a patient, and the patient knows that this will take time. And
Yeah.
when it comes to sports or ortho or neuro, there is a let me remove neuro from this list because it is something similar when it comes to the treatment plan protocol and the long duration of the treatment. But when it's an ortho sports, the patient waits for the pain relief, the quick pain relief, the quick muscle improvement, the movement improvement, range of motion improvement, and everything. When it comes to a patient who is having dyspnea, who is having breathlessness, if a patient is able to walk 2 steps, okay, without breathlessness, or if the patient can increase 2 steps with less difficulty in breathing, that is a progress in that patient. So imagine now you have so much to give to that patient, and the patient is ready to cooperate so much with you. So that elongates the duration as well and your reliability as well. So that's the beauty of being a cardiopulmonary physio, I feel.
Totally agreed, ma'am. So we have a question from Dr. Tanya. Grabbing a government job in physiotherapy should be the final aim, or entrepreneurship better in
Uh,
this profession?
grabbing a what? Government, I can't say the grabbing a government what? Can you repeat? Government
Therapy should be the
job.
final, or is entrepreneurship a better?
See, I don't think so. I think being an entrepreneur or having a government job, they both have their own beauty. Like I'm an entrepreneur and I love being that. If you'll give me a government job now, I may not take it and I'll continue being an entrepreneur. I don't know. Because I feel I can explore so much and I'm still exploring. And the thing is that I direct people to explore the same way. And the government job definitely gives you a lot of benefits, security, and definitely it is worth doing it. But you cannot compare it with being a professor in a private university or having a private job or being an entrepreneur. So I think it's up to you. See, to be honest, every physio who is studying right now, every physio who is a student in second or third year and who is there now listening to this, I'm sure they all must be worried about kitna kamayenge aage. Because that's what the biggest fear of Indian physiotherapists are, because we are not well paid that way when it comes to job or salary. So that is the reason I feel that entrepreneurship in physiotherapy gives you much more than what you can expect in any kind of job in professional life or professional salary that you get from getting attached to an institution. So it's simple thing. Start with a job, get explored, find your own ways, understand your passion, discover your passion, get explored to multiple patients, cases, and then start something of your own. I think that's how it should work if you are into any kind of medical profession. And I'm
Right.
sure a lot of people will support me with that also, because I believe in being independent, and I encourage people to be independent, not maybe immediately after you are working, but after a certain period of your life, because you're a physiotherapist and you have that thing in you that you can be independent. So I
I
hope that
totally agree with you. This is what our mentors also tell us, that this is the right way. You learn, you gain experience, and then you start over
answers.
your own track.
Exactly. Like, don't rush for money. You will otherwise be a master of none. And even pay, honestly, I see people now who have started working from third year, second year. They're going to see visits. They are seeing patients, and like they just are waiting how to finding out ways ki after fourth year how to get money and all. I don't think so that works. I'll tell you my first visit. Okay, now I've never told this to anyone. My first home visit after my internship was of rupees 100. Okay, and I did that because she was so poor, that lady, and may God rest her soul, she's no more. She was 99, she was unaffordable, and I was ready to treat her for free, but still she used to give me $100 by just for her self-respect. And I used to take that. My second visit was for 200. My third visit was for 300. And honestly, that time it was not for money. It was about the exposure. My first job was very low. I'm not going to even say about it. And maybe that's the reason I'm not working. I'm an entrepreneur, but that's how it goes. But still, I have done it happily because I think that has laid my foundation. When you don't work for money, for the first 2 years of your physio is all about exploring. Do observerships, do free observerships, join free clinics, join if you have to pay to some good setup to learn, then go and pay at that time, because you are just gaining experience, you're enriching yourself with experience, and then after a few years you'll come out as a brand in yourself, or a person who can actually create their own brand. So yes, I think that's how it works, that's how it should work.
Right. A lot of my seniors also tell me that why don't you start working in your fourth year, in the third year? And I clearly tell them that I do not have the experience or the knowledge to treat someone holistically. So why will I put someone into danger?
Exactly.
It's like putting.
Absolutely. You are putting the patient's life in danger, undoubtedly. See, even we ask our physios to do that, okay, but under our supervision. So if you have a senior who can supervise you, then there's nothing like that. But solely, I would not suggest. Honestly, I would never suggest that.
So we have another question. A student is asking that in second year, can I join a clinic and is it beneficial? So I think it comes down to the same thing.
Yeah. See, second year first, like during the second year, you don't even know what exactly physiotherapy is. You are still learning. You have just started learning about the theoretical part, and how can you apply when the application comes more in third and fourth year? So I would suggest, if you really want to join a clinic, if you have an option, then just go and sit in the clinic and observe what people do. That's okay. Observership is never a harm for any physio. I have observers from 12th standard who come and sit in my clinic, who wants to just observe how physiotherapy looks like, so that they can plan for it. It's a funny incident. In my last workshop, I think people who have joined me from Hyderabad, they knows it. So my workshop in Hyderabad, we had it just a couple of months back, and I had a student. I was not knowing whether she got enrolled or not. She was from 12th standard and she attended my workshop just because she wanted to know what she can do in physiotherapy, and she has been attending a lot of workshops. I don't know why. And at the end, she told me, "Ma'am, I don't know. I'm a science student. I am just attending all the workshops to develop or to see whether I'm interested in this field or not." And I was able to understand everything you said. And I'm so eager to practice chest physiotherapy in my patients if I join physiotherapy ahead. So that is a kind of observership that you do to know your interest. That is okay. But if you're a second year student, if you're coming to my clinic, I will not let you allow me to touch my patients. Let me tell you that. But you can always help and assist me.
This is
But I'll teach you. What?
back in class 10. Back in class 10. I used to go to various occupational therapists and physiotherapists and see what the field is actually about.
That's how you.
So that's how.
That's how you should do. You develop that interest. That's very important. Okay, so let's not bore the audience. Let's take the second question. I hope that clear.
Question: what are the advancements in cardiopulmonary physiotherapy?
Okay, so let me just start with some question. I hope who all are there. If we have a lot of physios, just one or two of you, if you can just take that much of effort to write it. What do you think chest physiotherapy is? When I talk about chest physiotherapy, what is the first thing that comes into your mind? I would appreciate if someone can just type and put something. Okay, Kashika, let me ask you. Let me do a back interview with you. Now she'll think, oh my God, why? I'm not in a Viva. So you only tell me, when you think about chest physiotherapy, okay, anytime, fine. What comes into your mind? Okay, ma'am ne chest physio pucha hai. Yes, see now you're getting Dr. Mahima percussion. Very
So
good. Come on, be quick. Let's give 2-3 minutes. Tell me, Kashika, you are also there. I want to know.
first thing is percussion,
Yeah.
suctioning, and vibration. These
Extend,
three words come.
yes, Dr. Kungun, extend lungs capacity, neuron cure without drug, Khushbu to treat patients who's having pulmonary problem, Jamshed auscultation, okay, cardiopulmonary uneza, making breathing easy for patients, okay, various pulmonary conditions, Gilani, I hope I'm Minaz. Then Darshana. I'm loving it. Come on, breathing exercises. Yes. Anything else? Thank you, Mr. Baba. Anything else? Anything else? Okay. Breathing percussion, chest vibration, breathing percussion, pulmonary conditions. This is what actually everyone thinks physio is all about. See, airway clearance. I can't see any answer which is outside ICU. Increasing capacity of lungs. Why? Because the patient has got pulmonary condition. That's what it is. So when we talk about chest physio, it's always about ICU, what you can do in the ICU, or what you can do with pulmonary patients, what you can do with respiratory patients, or what you can do with the patients who are admitted or having any kind of cardiac complications, pulmonary complications, post-surgical complications that is affecting your chest or your chest vitality and lung vitality and everything. See, someone has mentioned it is a holistic approach of patient from cardiopulmonary, aerobic, anaerobic, everything, chest, PNF. Yes, of course, true. Cardiopulmonary rehabilitation to get the patient out of ICU, feel relaxed and around chest pain. So that is what it is. It's all what we think, what you think. It's all about a patient. It's not always about the patient. When we talk about chest physiotherapy, it's about you, about me, about every person who is just listening here and joining us. That is what actually cardiorespiratory physiotherapy is about. The world is your client. You don't have to be patient to be a cardiopulmonary physio. Let me just give you an example. A 90-year lady, or let 90 is too old for a chest physio. Let's keep it 60. A 60-year-old lady comes to you walking. She's your patient. Why? Because with age, her lung functions would be reduced. If she's having underlying conditions, osteoporosis, and a lot of other issues, the muscular issue will be affected. The diaphragm will be weak because of the age, and if she's obese, so if she has got kids, again that will affect her diaphragm. That will affect her lung function. So everything is interrelated, and that's how you create a patient. So that is what I say is the most advanced chest physio is you creating your own patient. Now, when we talk about advanced chest physio, what I teach usually, and a lot of things what I teach in my workshop is actually all about manual practices of how you can trigger a breath in a patient with the manual techniques along with the team of your the medical team, and how you can trigger a breath in the patient and take that patient or make that patient go back to the occupation. So that's what is chest physio, and that's how you do it. So when we talk about advancement in chest physio is knowing about the fact that chest physio is not constricted just with chest percussion, vibration, breathing exercise. If you will ever attend my workshop, I think we lost the connectivity.
No, ma'am.
Hello,
No, ma'am.
Kashika. Are you there?
Yes, ma'am.
Okay.
Yes.
So if we talk about the chest physiotherapy, okay, it is not just about if you have attended my workshop anytime, okay, if any one of you, if I have any of my students, they all know that I never teach chest percussion and vibration. I never teach that because that is something you all know. I teach what you don't know, and that is what the advancement is. So when we talk about advancement, there are techniques from which you can make the patient trigger a breath, techniques with which you can make the patient normalize the breath, techniques with which you can actually manual techniques with which you can make the patient uh, use the muscles of respiration that they are not using because of the condition, and then gradually working on the entire neuromusculature of the patient, the neural, the muscular involvement, the cognitive functions, all that, like taking care of all that and building up a holistic approach is what cardiopulmonary physio is. Now, cardio-physio can be for anyone who is post-operative, who is pre-operative, who is pregnant, who is not pregnant, who is having dyspnea, who is not having dyspnea. Suppose you're talking to me, I'm talking to you, I may get breathless talking to you. So am I a patient? Am I a patient? Not really. So that is what it is about. So if you're into chest physio, you have to broaden your spectrum. You need to understand what it is. Now, of course, someone has mentioned about PNF techniques. Okay. You do learn some PNF techniques when you are inside the Indian curriculum. But actually, when you go beyond that, there are a lot of other techniques which are at least 20 to 30 number that we teach. So, and that is how you beautifully design your protocol. And it is not actually called PNF, it is called neurophysiological facilitation, stimulation, inhibition. A lot of things are there that works so beautifully on your patients. So when I have done a lot of workshops with my patients, they keep on sending me the results after that, and I'm gonna really post up the results. I never got time to do that. There are so many beautiful results of the x-rays that I've got after they have started using my techniques. That it's not my technique, but yes, some are designed by our team, and we have taken the patent, its patent as well. So there are a lot of techniques that we use for our patients, and it gives amazing results. So what I can say is, please come and join my workshop if you really want to know the advancements. Because Insta Live is too less to actually explain it. So what I would suggest, please ask your questions directly about the condition or anything if you have, and I can answer you to the point about what you're trying to understand. That would be apt.
Yeah. So, ma'am, there is another question from Yashwan, that what is the role of community medicine in physiotherapy?
See, community medicine has got it's a CBR that we used to do during our college. Community medicine has got a very important role when it comes to outside India. If you will see in Canada, if you would see in Australia, US, the community medicine physios are really doing amazing when it comes to old age homes, geriatrics, and also community medicine holds a good importance. And if you're planning to do your masters in that, then let me tell you, cardio, gynae, community medicine, these are the upcoming profession. So community medicine, of course, because we are not talking about it, so I won't go in detail about that. But yes, community medicine is an upcoming profession, and you can really opt, especially if you are planning to go out of India. It will give you a very great opportunities over there. I hope that answers.
Dr. Gungun, ma'am, can you please suggest colleges for MPT and for MPT
I don't think this is a platform to actually suggest colleges for MPT because there are hundreds of colleges, and I have a lot of friends who are principals. So, no, that's not, I'm not biased that way. But, honestly, I'll tell you, please give your All India entrance exam, or if you have private college examinations or the state examinations, go through that. Now, how to select the college, that I can tell you, rather than, just looking for the college for this thing. First, you have to see the credentials of the college, if it is credited with the highest authority of credentials, okay, like NAC and above. And secondly, you have to see that which all hospitals does that college gives you attachment with. So always inquire where these hospitals are posting you during the masters. Okay, that gives you the best idea about the exposure that you will get. Because honestly, it's all about what exposure you're getting from the college and the credentials. Rest, the area, the locality, the structure of the college, the beauty of the place doesn't matter. So accordingly, you can check on that. I hope that answers. Okay, I think we have one question. What will be the treatment and or technique used in the case of pneumonia? Well, see, pneumonia is the most common condition, the commonest condition you can say. And after COVID, especially the COVID pneumonia became very much prevalent. Even now, if you will see a lot of patients who comes to you with just fatigue also have a history of pneumonia. So when, as a physio, how to treat a pneumonia, first you need to understand it falls in which category of condition. Now, the respiratory conditions are divided into various forms, okay? Obstructive, restrictive, and mixed. So first you have to understand which is the criteria. So now COVID-19 condition is basically a fibrotic condition. It leads to fibrosis. So we consider COVID-19 pneumonia as a restrictive one. So you need to first go through it, whether the pneumonia is bacterial, viral, COVID related, and then we plan the treatment. The best treatment for pneumonia is expanding the lungs, keeping the lung clear, bronchial hygiene, working on the muscles, because your muscles goes into, you can say your muscles are overworked to overcome with the condition. Check for the consolidated areas. You have to, if you can see the x-rays, that's what I teach as well. Check for the consolidated areas on the x-ray, work on those areas more. Okay, so focus on segmental expansion, but there is a trick to follow that when you focus on segmental expansion, again, which I teach. So taking care of all these things, that's how you actually plan a treatment of a patient who is having pneumonia. Again, for pneumonia, you have to see at which level the consolidation is. A very simple example. If you will pick up an x-ray of if you have seen CT scan of a COVID pneumonia, they usually write ground glass opacities, or like a proper consolidation. So you have, that are the stages of the development of the pneumonia. So accordingly we plan the treatment. So actually pneumonia, if you will ask any student, they would say breathing exercises, but it's way beyond that. It's way beyond that. So I hope you can, if you have any patient, if any one of you are having any patient and they are finding any difficulty to treat the patient, please put your messages on my inbox. Send me the x-ray, send me the current status of your patient and what treatment you are giving. I will help you with whatever you can add in the treatment with that patient. That's the best I can do.
And that's a great idea. So we have one more question from Prasiddhi. She says that she really loves neuro and cardio both, but she's confused. And she's also asking the difference in clinical practice of neuro and cardio.
So see, basically, somehow, if you would see, if a person is having a neurological condition, somehow the cardiac factor, the cardiorespiratory factor is involved. So even if you are a neurophysiotherapist, you have to take care of the entire cardiorespiratory thing. So if you love neuro, I would prefer go for neuro and add cardiorespiratory practice into it. Fine. If neuro is your first choice, if you are interested in cardiorespiratory, then do it isolatedly. So, but if a person who loves neuro primarily doesn't have to worry, because anyway they will have to see that patient for cardiorespiratory perspective. Let me take an example of a Parkinson patient. In a Parkinson patient or any other patients, if you would see mainly with ongoing degeneration, neurological conditions, gradually the respiratory system compromises. Okay, and that's how everything comes into picture. You're getting my point, what I'm trying to say. So if you're a neuro lover, please go for neuro and add cardiopulmonary into that. That will actually be a good holistic plan for the patient. Secondly, about the clinical practice, neuro has got a very good clinical scope. If you're joining any rehabilitation center or any rehabilitation or a PEDS center, adult rehabilitation center, neurological rehabilitation center, we have a lot in India, like Haji Ali rehabilitation, a lot other than that. And when it comes to clinical cardiopulmonary clinical practice as well, as I said in the beginning of the workshop, you can have your own clinical setup even if you're a cardiopulmonary rehab. Even I have it, a lot of physios are having it. I have my own pulmonary rehab department, outpatient. A lot of other physios are also having it. So yes, the world is yours, I should say. Think wisely. I hope that answers.
So we have one question from Roshan. Hemiplegic patient having severe mucus plug in left lower lobe. What should be the treatment?
If the patient is hemiplegic and if the patient is having it in the left lower lobe, right? I heard it right because I can't see the question. Okay, see, first of all, for the hemiplegic patient, if it's on the same side or if it's on the other side, that matters. So positioning is very important for any hemiplegic patient. Okay, now when you do the positioning, you have to manage the duration accordingly. So if the lobe is on the same side of the same affected side, okay, then definitely you cannot put that patient for long on that position. Okay, because of course we need to keep that. If you know the 2:1 ratio and a lot of ratios, that's how we work with the neuro patients and the cardiac patients. So entirely the positioning depends on the affected side. So first thing is definitely positioning works a great role when you have any kind of neuro case. Along with that, the manual techniques which I was talking about, neurophysiological facilitation, the PNF techniques that I teach, then we have a lot of techniques which works wonderfully on such kind of patients. Work on the diaphragm, work on their respiratory muscles manually, work on the positioning plus muscle pattern, work on the positioning plus muscle techniques that we use. Along with that, if the patient is responsive, try to give speech therapy to that patient. So when I'm talking about speech therapy, it's not for the speech, but it's for the working of the neck muscles, the glottis and everything, so that you can help the patient to expectorate in a certain way. So all that thing is, it's a huge treatment actually when it comes to hemiplegia plus a respiratory involvement. So it's not about just percussion. Even if you're giving percussion and all, that's the basic that you all know. But along with that, working on that area manually and with the bronchial hygiene part is how you should plan a protocol. Again, I would say send the details of your patients and what you're doing. I'll add on to your treatment. Definitely, I'll guide you with that. I hope that helps.
I think that answered Roshan's question.
Yeah.
So Dr. Bhumika is asking, good evening, ma'am. planning to do my master's in USA. So according to you, what branch will be the best for me?
Uh, honestly, I am an Indian physio. So, honest, and I have a lot of friends in US as well who are doing very well. But I think when you are in US, it's very much the locality based where you are planning to get your master's done. So, to be honest, I am not a correct person to tell you which branch is best for US. If that is something that I don't know everything, to be honest. So I cannot really help you with that. But yes, in US also, sports, ortho, or you can say chest physio, everything. Community medicine. Community medicine is also a very in thing over there. So I think these four branches are doing really well, like all the branches. So it all depends on the locality you do. If you're in UK, I can still tell you if you're going to UK, go for sports. I think that's the best because sports medicine, what you have in UK, it's one of the best. If you're going to Canada, then again you have different, it's all locality based. So in US also you have region based specialties. So please, I think someone else can answer this better than me.
Okay. So there's one more question. What are the types of combination therapy in cardiopulmonary therapy and rehab? It's by
Combination, there are you have to ask me on what perspective are you asking me, on what regards? Because combination therapy comes for a lot of things. You have to first tell me the condition, and then I can tell you what all combination therapy we can use. You cannot just abruptly, and if someone answers this question abruptly, then I don't think so. They're really treating original patients. You can never. First thing, let me tell you one thing. If you are a cardiopulmonary therapist, you need to understand one thing. You can never say कि okay, ये patient है, इसका ये treatment होगा. You can never give a set protocol to any patient. Every patient is different. Even if you're having one pneumonia case on one bed and the same age patient with the same low pneumonia, with the same vitals, with the same condition on the other bed, the treatment of both the patients will still be very, very, very different depending on a lot of underlying factors. So you can never have a set protocol for any cardiopulmonary condition. That's why we give you the world of treatment and you have to decide from that. And that's how you create your combinations as well. So we can never give you combination without knowing what condition, what are the basic vitals and BMI and basic age criteria, everything of the patient, and then I can help you with that. I hope that gives you the answer.
So there's another question. From where did you get the motivation to do so much in the field about which not many are aware of? And this was a question that what motivated you to become a cardiologist?
Okay, well, honestly, I think, see, as I said, like how I joined this, because this was a thing which I was not aware of. And just a second, I think there's some disturbance. Yeah, okay. So I hope, am I audible? So I think motivation comes with your work. When you treat one patient, you feel better, you try to do better with the other patient. So I have never taken any motivation from anywhere or anyone else, but it's, I think, the patient's feedbacks, first thing, that motivated me to be a better physio. Students' feedbacks that motivated me to be a better into academics and a good tutor. And the entire teamwork, my mentors, my teachers, my students. I think I learn a lot from my students. Let me tell you that. Whenever I go to one workshop, somehow I come out learning something new. And I think that's the beauty of teaching the young generation, you can say. So I learn a lot from my students, a lot from my students. I won't deny that fact. So I'm glad, I'm thankful if you feel that, like I'm doing something well. That's why you asked me this question. But the motivation is everywhere. Now I'm talking to you. I'm motivated to know about the USA part because someone asked me about US and I really don't know which branch is good over there. So now I got a motivation to know about that. So I think you find your own motivation from everywhere that you're listening, hearing, observing, and seeing. That's it. And taking cardio was honestly a choice because I wanted to know about a field which I'd never explored. And when I learned about cardiopulmonary, then I realized that what I know is still something that others don't know. And that's why people behave like me when they are an intern. And that's why I started learning more, teaching more, exploring more. I did my super specialization in this from Singapore as well. I got to know new techniques, how people outside India are doing it. Then going to different countries also helps you a lot to understand the pattern. Like I've done uh, being in Africa, Singapore, UAE, then teaching patients of different people of different places, Philippines, Bangladesh, a lot of other countries. So when you go, when you see the culture over there, what they are doing, you pile up everything and then you create a protocol which is evidence based. And that's how my entire treatment protocol and what I teach is designed. It's all evidence based, it's piled up, and with a lot of different protocols. And that, I think, gives you more motivation to learn and to teach. That's it. I think that's
That's
all.
really.
Yeah.
We have one last question, I think, that how to cope with bed sores in ICU patients or bedridden patients. And the same person is asking about the benefit of chest PT in autism patients.
In which patient?
Autism patients.
Okay. See, first of all, bed sores, the basic funda is positioning, turning the patient every 2 hours or according to the patient's condition. Okay. And plus keeping the area moist and not allowing the area dry, or, for the skin to allow to peel and everything. So basically, it's not, you don't have to wait for the bed sore to happen and then treat it. The best way is to prevent the bed sore. So any patient who is bedridden for 10 days also, you have to start working on the protocol of prevention of bed sores. So, okay, by continuous positioning, giving them water bag, so that the areas where the pressure sores are developed, that is not happening. So pressure sores can be controlled with a variety of preventive measures. Okay. And once it's aggravated, if the patient is already having a severe bed sore, then it becomes really difficult to actually, help us to heal the patient if the patient is completely bedridden. So positioning, trying to make the patient sit on the edge of the bed with support, continuously dressing the area, trying it, putting the antibiotics, antifungal, all that helps to prevent the bed sores once it's done. Now, coming to the autism patient, again, it depends on the severity of the condition, if respiratory functions are affected, or if it's not affected, then working on the proper cardiorespiratory fitness of the patient from the beginning to not to allow this happen. Same thing I would say for even Parkinson patient. If you are a physio who is treating a Parkinson patient, then start working on the cardiorespiratory fitness of that patient, because as the disease will progress, gradually the respiratory functions will be affected. So why to wait for that to happen? And that doesn't happen in 1 year. That happens after 6 years, 7 years, 10 years of it. Got it? So that's how you have to really, if you're into neuro, if you're seeing neuro cases, don't wait the respiratory or cardiac system to get affected. If you're a good physio, add it to your treatment from day one when the patient comes to you. And that's how you actually help the patient. You are able to actually give a better benefit to the patient, because any kind of respiratory treatment that you give improves the oxygenation in the entire musculature system of the patient. So definitely, if the musculature oxygenation is increased, that also increases the productivity of the patient, the ability of movement of the patient, range of motion of the patient, reduces the fatigue of the patient, increases the uh, standard of life of the patient and the quality of life. So imagine just adding one thing to your treatment of anything that you do can make a huge difference. I hope that answers your question.
So we do not have any more questions now.
I think there
If
is
anyone
someone
wants,
who has taken my interview from News 18. How do you feel after gaining recognition at such a young age? Okay. Mr. Bharatwaj, I think you have taken my interview from News 18, so that's why I know, maybe because he has mentioned it over there. Well, I would just say thank you. And it's all because of God and family, that's it. Yeah, please, next question. If any more questions, then please tell me.
there are no more questions in our question section, uh, people can write their questions in the comment section.
Okay. Okay, so I think we are done. We have answered a lot of questions, Kashika. Now you can ask me your personal question if you have, or we can just move ahead.
So, not any specific questions, just wanted to thank you for being here. And so, I attended your workshop during the COVID time, and that's how I got to know about cardiopulmonary physiotherapy. And that's how now I'm planning to join an MPT.
Oh, you're planning for MPT cardio? Yeah, I can't hear you. What? You're
So,
planning for
yes, and
MPT cardio?
Yes.
Oh
So you
wow,
were a
that's
great.
nice. I'm so happy, trust me, it makes me feel so good. A lot of students after joining the workshop who have no idea are joining MPT cardio after various workshops that I take. And I think that's I'm so contented and satisfied with that thing, na, ki that's amazing. That's amazing. And I'm always there to guide you all if there is anything that I can do from my end. All my students are always connected to me. I try my best to uh, be to reciprocate to whatever they ask. And to all the students, if I have my students and participants or physios who have attended my workshop or in touch with me, I'm always there. Please, if you find your any difficulty with patients, I don't promise that I'll immediately reply you. It's difficult. It's always flooded my Instagram, but still I would try to help you as much as possible from my end.
And I'm there too. That when are you hosting your session in Jaipur? And I'll be asking when are you coming back to Delhi?
Okay, so Jaipur, we are yet to plan. Now my next workshop is in Dubai. Then we have in different countries as well, and then we are planning for March for the upcoming cities. I can tell you, we are having in Mumbai, Hyderabad. We are doing it in Chennai, Cochin, Kerala. Uh, we are also planning for. I have a list of places. I'll just put it. Delhi also we are planning. Definitely yes, we are planning for Delhi mostly by March end or April, and Calcutta, Guwahati, Assam, and a lot of other places. So Chandigarh, yes. Someone has also asked me about Chandigarh. Yes, yes, we are planning for Chandigarh as well. So yes, we will be coming to your cities, and also if you want to organize it in your place, if you have some students or anything, you can always approach us. We can help you to do that as well. So let's see. Keep following me so that I can update you about it. That's it.
Okay. I think we are done with the questions. Someone is asking what are the guidelines for pursuing MPT in cardio?
Honestly, guideline, there is no guideline. You should be interested first of all, and second thing about the entrance exam. If you have to just check with the colleges and you have to give the entrance exam over there for the certain field. And if they select you, it's all. There is no guideline as such unless the entrance exam for this thing. And definitely every university have got their own criterias to get admission into that. That's all. For Kolkata, when will be the workshop of yours? We are planning for Calcutta. Yes, the dates are yet to release, but yes, it will be released soon. But yes, Calcutta is there this year for sure. Yeah.
I think that answers all of our questions today.
Okay. So thank you all. I think that was a great session. I'm so glad for all the questions. And thank you, Kashika. And thank you, all of you, for tolerating my network glitch for some time, for being so patient and cooperative. And thank you for being the lovely audience.
Thank you so much, ma'am, for joining us and coming and joining with PhysioEd. And thank you everyone for joining us here today.
Thank you so much. It's my pleasure, definitely. Thank you and all the best to all of you.
Thank you, everyone.